Yes, hello everyone. Today I've come to share with you something small but serious. Like I've been wondering always, why should you yell at a healthy worker? Most of the caretakers, why should you yell at a nurse? Why should you yell at a nurse? There are some things that always happen behind the scenes that, of course, a caretaker and the patient cannot know. But of course, those things that always happen, there's a way how they lead to delayment in service delivery. And on the other side of the caretaker and the patient, they always take it as negligence. But in actual sense, you find that it is not negligence, but it is those other things that we do backdoor that lead to some bit of delay to service deliveries. And these are the things that I want to give you a small light on. So, you see that boy, that nurse, a girl, a boy, or a man, whatever you call him in your site. First of all, that man or boy has to works 12-hour shift. 12-hour shift, it means he works 12 hours in a day. Meaning that if he works day duty, he will report at 8 a.m. and leaves at 8 p.m. And do you know what he's supposed to do in those 8 hours? He's supposed to do vital monitoring of the patients in the ward. He's supposed to do drug administration. He's supposed to go to the pharmacy, collect drugs for the patients in the ward. He's supposed to take blood samples from patients who need tests. Take their blood samples or any samples that the doctors have requested and take them to the lab and also follow up for the results. For those hospitals who have not yet developed some systems where they can share the information easily with the system. And of course, those ones are many. Those ones who know those ones without the system in our country, there are very many. So you'll find that also there are some surgical procedures that is supposed to do in a day. There's wound dressing or cannulation, um, taking the patients to the theater, depending on the ward you are working from. And unfortunately, also the ratio of nurses in the ward to the patients that are supposed to be served is so small. For example, you will find like 2 nurses in the ward of 30 patients. If the patients are few, you will find there 14 nurses. Yet ideally, for me to provide efficient work, and I also feel that I have at least given good service best of my best, I'm supposed to be at least allocated like only 3 patients. There you know I would I would treat everything. I would do physical treatment, psychological therapy. I will get enough time to interact with my patient. We shall. I will really go. I will really go deep. I will make a serious relationship with the patient, of which that is very impossible in our health system. It is very impossible. So, because of those impossibilities, you'll find that there are few nurses on the ward, but activities to be done are many. So, by all means, because of that, you find service delivery as a bit delayed. The service delivery will delay slightly. Of course, we shall try, as we always do. We shall always try to make sure we give best of our best. But of course, with the situation at hand, you cannot force the situation. If it has to happen, it will happen. And of course, now that one, it is us who know, maybe with the government, but our dear clients, our dear caretakers and patients, they don't know that. And we don't blame them for that, for not knowing about that. But me, I'm suggesting, instead of yelling at a health worker because of maybe delayed service delivery, maybe they are delayed to work on a patient a bit, because the delay is not always too much also. We always try our best to make sure that we at least serve people in time. But of course, the delays are always there. I cannot remove that and I cannot refuse it. So for me, I was suggesting that instead of shouting, yelling at the health workers, please always try to take time and observe the situation in the hospital you are. In any hospital, because the system is the same. There are very few hospitals where you find the speed is very good, is 100% perfect. There are very few. I don't, in Uganda, I don't know even. Everywhere you'll find some delay, some sitting somewhere. Sitting, waiting, you'll find it there. So for me, as I'm saying, first observe the situation, first observe what is taking place. If you want to know something, don't quarrel so that you can bring attention of the health workers. No. Move gently. You ask anything you want to know to a health worker in a respective way. Whether a nurse, whether anyone, a health worker. If you want to know anything, maybe they are there to work on your patient and want to know the reason why, ask. If he doesn't know, he will direct you where you're supposed to go and ask. And if he directs you, doesn't mean that he has dodged you, no. Ideally, I'm supposed to answer the questions that I can manage to answer, and the questions which I cannot manage to answer, I can always refer to people who can answer them. And it is not bad to not know what to not know some questions, because you are not supposed. I'm not supposed to know everything. But by the time you see that a health worker telling you that they know everything, then you query, because we work as a team. The reason why we work as a team is that there's something that me and the nurse I can do, and maybe a doctor will not do. And many things a doctor can do and the nurse cannot do. So when you approach me and you ask me about something and I tell you, please, maybe go and ask that person, don't take it bad. Or if I tell you I will ask another person, don't take it bad. So always try to ask respectively, because even as we are subjected to psychological torture. You will yell at me, I will not answer anything. I will not actually give back. I will not yell at you also. Because according to our ethical code of conduct, we are not supposed to raise arguments with the patients, even the caretakers. So you may quarrel to me and I keep quiet, but just know you have tortured me psychologically, because There's no any person that they will shout at and you remain in the normal state. It is very hard and it is uncontrollable. It is uncontrollable. You cannot remain in the same state. And look at this service provider you are quarreling to. You have changed their emotions. Of course, now they will provide you services, but not with a happy mind. And of course, there will be some small difference of someone providing you services with a happy mind and someone providing you services with a tortured mind. They are almost the same, but there will be a slight difference, of which this difference will be on psychological treatment. Me, I will come, I do drug administration, and other parts of psychological management, what I may not be able to give it because I'm already sick. I also already have psychological problem because of you yelling at me. So that one I cannot give it out. It's hard. I can do this other physical management, and that's why you see them come give medicine and they go, no time. Reason being already tortured. But there is no good thing when a nurse gives you all his or her time, gives you advice with a good smile, creates a very good relationship with you. That one also promotes healing of the patient. But it is very hard to promote a relationship with a patient whose caretaker is not cooperative, whose caretaker always shouting at me. It's hard. I can try to control, but it's really pretense. Egera kubera pretense yenini. So I'm advising our dear clients, our dear caretakers, our dear patients, when you're in the hospital, any hospital, be it government or private, try to be cooperative. Anything they tell you, try to follow. Try to listen to the information they always give you. If you see information they give you is not rhyming with what you are expecting, try to ask questions in a respective way. So if you do that, you will help us to give services efficient way amidst of having serious tasks that we have to do in a day. But at least if you have just tasks disturbing you, only tasks disturbing you that you're supposed to do, the only one disturbing you, not people, you can easily work well. But now if you have these serious tasks disturbing you, you have to serve 30 patients in a day. You have to move to the pharmacy, you have to move to the lab, you have to move to the theater, you have to move almost every department. By the time you leave the hospital, you find you have moved a lot. By the time you finish your duty, you're already tired. And now you have again torture from people. It makes life of a nurse very hard. It makes life of a nurse very hard, and that's why you see sometimes they put plastic smiles and they administer their medicine and they go. Not because they are doing it intentionally, it's because of their emotional torture they always get, and sometimes it can overwhelm them and it is very hard to control. So help us. Don't always yell at health workers. Thank you.